Hi everyone, I'm Stephanie with Nine Health. I'm just making sure we're connected here. I'm joining you via Zoom. I'll introduce our guest in just one moment. Want to make sure that we are all good here. So all this week we're focusing on your mental health and relieving anxiety in this uncertain time that we're kind of all dealing with. Again, we're joining you via Zoom. I'm with Jamie Driver, and she's a yoga therapist. She provides integrative wellness services also for professionals, such as medical workers, first responders. So she has some great tips on relieving anxiety for those groups, and also some things that we can all be doing ourselves while we're all at home, maybe stuck in our homes, maybe you're alone in your house, practicing social distancing, or as you know, the mayor of Denver put a, the stay-at-home orders in for Denver today. So we're all in our homes and in our houses, and could probably use a little relief, some tips for relieving anxiety and our mental stress in this pandemic. So first, I just want to, and you can ask your questions, feel free to post those in the feed. But first, I just want to get started with Jamie, let her introduce herself, and then let's get to talking kind of about the mental stress and the mental strain that this pandemic can have on healthcare workers and providers.
Thanks. So yes, my name is Jamie. I am a yoga therapist. Yoga therapy is a little bit different than what you would consider kind of group exercise, fitness yoga. Simply put, yoga therapy is healing centered. So I have that background. Been practicing for almost 20 years and teaching for almost 10. And I also started working on healthcare provider burnout about 7 years ago. And I started offering my tools and the skills that I have to medical professionals. Once I learned that burnout was something that they experience, I wanted to empower them so that for every person that I help, I'm helping all of their patients or civilians, etc. And so in order to get a better understanding of what they experience in their workplace, I worked with vets with PTSD for a couple of years to really understand CPTSD and chronic pain. And then I also ended up doing 2.5 years of service and end-of-life care. I did that so that I could witness death and dying, because that's what these people are doing, so that I could understand what that feels like in the mind body, and then be able to utilize the tools that I already have and create new tools to help these people, because they are showing up and they're willing to witness this deep suffering. Something in them, whatever that may be, is calling them to show up for us. So we need to take really good care of these people.
Right, as someone just commented that they're a nurse and really worried for their family. So kind of talk about strategies. You know, they're human too, and they're being told to take care of all of us, but they also have to take care of maybe families at home or friends around them. So what are some ways that these healthcare workers can really, kind of separate the two, but also, just help with things at home and help with their own mental health?
Yep. So as far as we're all going through this experience together, in that we're all witnessing deep suffering and death. And that's different when you're maybe in the confines of your own home watching it on a television versus being on the front lines. But there are similar experiences for the mind body, and the way that we treat and manage those things, we're using sort of similar skills. It's obviously very different in intensity, but there are similar skills. And so to begin with, just acknowledging that that's hard. It's something that is not normal. And even if you work in a hospital setting, the amount of suffering that you're going to be or are already being exposed to may be much greater than normal. And so all of the feelings that we're all going through are totally valid, and just holding space for that, because this is hard, right? It's just hard. And so practicing some self-compassion and some self-love is really important at this time too. So one of the things that I really want to stress for people is this idea of what's called empathic resonance, and eventually can turn into empathic overarousal. A lot of people use the term compassion fatigue, but those of us in the contemplative sciences that are more progressive are trying to steer away from that term and use empathic over-arousal instead. And I'll get into more of the differences later. But what happens for all human beings, all Homo sapiens, in order for us, our species, to survive on this planet, we developed what are called mirror neurons. And so when I witness another Homo sapien suffering, I am sharing in the suffering with them so that I can take action to help relieve that suffering and that we can all survive and procreate and the survival of the species, right? So what happens is that there were people doing studies on empathy for pain. And what they were able to see is that it doesn't matter necessarily whether you're watching a movie or you see it in person, or even if it's someone you know or someone you don't know, we all have these mirror neurons, and we are all having this part of our brain light up as if we are sharing in the suffering. Okay, so that's empathy. And that's something that's very natural. It comes natural to us. And when people get burnout or experiencing lots of vicarious trauma, it's because they're sharing in a lot of the suffering that they're seeing. And so we really want to all differentiate between empathy and compassion. And these are not just feel-good words. We've actually been able to show this in the brain. So there was people doing research on empathy for pain, and they were working with this guy, Matthew Ricard. He is a Buddhist monk. So they thought, well, this would be fun. Let's bring him in here and see what happens. And we hook him up to this MRI machine. So they're seeing all this sharing and the suffering in people's brains, and they bring this guy in, and his brain doesn't look like everyone else's. And they say, well, what are you doing? And he said, well, I'm practicing loving kindness. I'm extending compassion, metta. And they said, well, stop doing that. And so then his brain looked like everyone else's. So they thought, well, that's really interesting. Can we teach that to people? And they were able to show that, yes, within just a day, learning these skills, people are able to differentiate. And so what I'll say from the perspective taking is that compassion comes from a sense of groundedness in the self, and you're extending kindness and compassion to the other, as opposed to I'm sharing in the suffering and I'm getting lost in the experience of the other, and we're the same. So boundaries, right? We want to create boundaries mentally, energetically, and that again goes for everyone, but especially the healthcare providers that are witnessing this over and over and over and over, and they're sharing in this deep suffering all day long. So no wonder they're getting burnout, right? I mean, that makes sense. So what we can all do as we are preparing ourselves to turn on the news. So that's another thing, is those clear boundaries of now is when I'm going to consume this information, or now is when, as a healthcare worker, I'm showing up to work. Sitting with yourself for a moment, maybe 5 minutes even, and just getting really grounded, feeling the bottoms of your feet on the floor, doing a body scan, doing some deep belly breathing is really important. Grounding within the self before you enter that space where there's going to be suffering.
Right. So, and I do want to just interject for one moment, because we did have Dr. Coley join us, 9 Health expert Dr. Coley. So she's going to just help chime in as well. I wasn't sure if she'd be able to join us or not today, but she is. So thank you for joining us, Dr. Coley. And again, we're with Jamie Driver. She's a yoga therapist. She also provides integrative wellness services for professionals such as healthcare workers. So we're just getting her tips on dealing with some of the strain and mental stress these healthcare workers are under right now, and then also just tips for the rest of us as we deal with some maybe anxiety surrounding the coronavirus and COVID-19. So Jamie, you're just talking about grounding themselves and being present where they're at. Maybe you can just continue to expand on that. And if you have questions, go ahead and post those as well, and we will get them answered by Jamie and Dr. Coley.
Cool. Yeah. So boundaries again, having clear distinction between Now is when I'm going to be safe and grounded within myself and be present with myself. And now is when I'm going to go into a situation where I'm experiencing and sharing an environment of suffering with others. And so being able to ground yourself, what does that mean? We talk about that all the time. I think that means embodiment. So a clinical term for that is interoception. A lot of us go around like we're floating heads. So feeling into your body, that's where yoga can be really helpful. But, any kind of somatic work, dancing, if you can ride a bike or go hiking, maintaining, of course, the 6-foot rule, whatever you can do to feel embodied is going to be grounding. And then, of course, spending time in nature. Nature is our greatest healer, and that is very grounding as well. So step one is really just grounding yourself. And then again, differentiating between empathy and compassion. And then really just kind of dividing the rest of the tools and skills I wanted to talk about into the breath, the body, and the mind. So something that we can, again, all do, because we are all Homo sapiens, right, is mindful belly breathing. And what happens when we're experiencing stress and anxiety a lot of the time is people start breathing into their upper chest, and they're taking shallow breaths in and out through the mouth. And so we want to do what's called diaphragmatic breathing. So you take the breath in through the nostrils, down through the throat, into upper lungs, lower lungs, all the way to the belly. And then the belly expands like a balloon. And then smooth transition as you begin to exhale, belly contracts, air exits all the way out through the nostrils. And so if you're in the midst of a panic attack, that might feel hard. But if you're practicing mindful belly breathing on a regular basis, that is going to send a message to your nervous system that you're safe. It's activating what's called the vagus nerve, parasympathetic nervous system, telling your body that it's okay to rest and calm down. So that's something that we have control over. When you start getting lost in thoughts and maybe starting to spin out, coming back to the breath, coming to the present moment, and just doing that mindful belly breathing. Eyes can be open or closed, really up to you. If you're really having bad anxiety, I actually recommend keeping the eyes open so you stay grounded to physical reality instead of all the what ifs and things that you could spin into. And so mindful belly breathing in the present moment with the breath, and then what that does for the body. So remember that the body, we have 5 senses, right? And so what a lot of trauma therapy now is based in what's called polyvagal theory. And I won't get super into the science right now, but what's important to know about that is your nervous system and your mind body, it's all connected, right, is always differentiating between what you perceive to be safe or unsafe. And what's interesting is that we're going through this collective experience in our homes because we're quarantined, and our homes are normally our safe space. And now we have this information like coming to us all the time, telling us that we're not safe and we can't go out and do what we normally do. And so in our safe space, it has become unsafe. And so if you have the capability, I highly recommend watching, if you're going to watch the news, if you're going to consume news, do it in a specific part of the house that is maybe different from where you're trying to relax. So if you're lucky enough to have, let's say, a TV in your kitchen, or you could turn it that way, and then your couch where you're hanging out the rest of the day, watch the news like just in the kitchen, or don't bring it into your bedroom, right? The bedroom is just where we're safe and we're sleeping. So what are ways that we can all differentiate between safe and unsafe within our minds and our bodies using all of our senses? So having a nice fuzzy blanket that makes us feel safe, listening to music that is calming, ambient noises, not really stimulating, eating comfort food. You know, I'm not a nutritionist, I'm from the South, so I eat lots of comfort food, but you can eat healthy comfort food, root vegetables, warm foods, and then staying hydrated also. Like, don't forget to drink water. When I was doing hospice work, I was always just reminding people, like, hey, have you had water today? Let's get you some water. So really simple things like that. And ambient lighting as well. Notice if you're getting really tweaked out, what's the lighting like? Can you dim the lights a little bit? And staying warm. You don't want to be cold. That agitates the nervous system as well. And there are lots of tips that I could recommend that I could have on my social media or on my website. But what's important to remember is that we all have different perspectives, right? So what seems safe to one person might not seem safe to another. And these tools are really in your toolbox to come up for yourself. So what is, again, a way that you can create a safe space where nothing can get to you? And then part of that kind of flows into, in yoga or even in Buddhism, talking about mantra. You may have heard that before, like repeating the same word over and over. And this actually is also based in science as well. We have what's called Hebb's law. So neurons that fire together wire together. And so if your brain, even your subconscious thought patterns are yourself telling yourself, I'm not safe, I'm not okay, this is bad, this is wrong, this is going to be bad, that is going to be more cemented into your brain and into your nervous system than more reassuring statements. And this is weird. This whole experience is weird for us. So honoring that, but what you can do is take time out of your day to say, in this moment, I am safe, I am healthy. And to give your brain and your nervous system that sort of reassurance to balance the rest of the day when you're getting messages that are telling you the exact opposite. So moving sort of into the mind there, you can come up with your own mantra. Right now, I have a Zen background, so my mantra is like, let go or be dragged. I'm just trying to release. But using that can help you also with mindfulness when you recognize, like, starting to get really anxious and worrying about things I can't control. Like, what can I remind myself? Yeah, empathy, compassion, we talked about.
And I want to just say really quick, I know that Dr. Coley joined us. She's going to have to go now to do some stuff for 9 News because she's a very busy woman, but thank you so much for at least checking in on us. If you have a question for Dr. Coley, you can put them in the feed and I'll get those to her later and she can answer some of those. Again, though, we're just talking about mental health and anxiety. Dr. Coley, before you go, I don't know if you want to kind of offer any comments or insights about this. I know you have, friends obviously in the medical field. You're in the medical field as well. Anything that you want to say?
I think Jamie's giving some great tips. I just wanted to say a few things about who are the high-risk populations for this. So the first is, the elderly, the people that are high risk from COVID-19 themselves, because the virus is more likely to cause complications in them, physical complications and death. They're more at risk for mental complications. The second high-risk group is children and teenagers, because they may not understand what's going on. The third high-risk group, I think Jamie touched on, which is healthcare workers and those people really at the front lines. And then the final is those with the prior history of mental health disorders. So if you fall into one of those groups or know somebody that does, really try to take these tips to heart, because this is a super high stress period and we all got to look out for each other.
Yes, well said. And we will let you go and do stuff for the 9 News and do stuff on air. And thank you again for joining us. And we will be doing stuff all week. And Dr. Coley will try to join us when she can to offer some tips and insight as well. Thank you so much.
Bye-bye.
Bye. So again, we're with Jamie Driver. She is a yoga therapist, also provides integrative wellness services for professionals such as medical workers, first responders. She's giving us a lot of great tips on just kind of decompressing, handling this situation for ourselves. And then even if you're a healthcare worker, kind of just probably working extra hours, working long days, and just trying to, when you leave, compress and kind of relieve some of that stress, even though you're taking care of patients, but you're also taking care of your family. So there's a lot of stress there for our healthcare workers that are on the front lines taking care of us. Maybe you can talk a little bit about that support role that maybe family members and friends would play for someone that is in the healthcare system, and what kind of support we can provide to them in this world of social distancing, of course, but what kind of support we can provide.
Yes. So glad you asked. Was moving just into this. So, you know, the healthcare workers are going through a lot just on top of their normal jobs. They are also dealing with all of these different protocol changes. They're getting emails and texts all day long. And then they're also having to worry about this personal protective equipment, which should not be a concern of theirs, frankly. So again, all of these things that I just described, what does it come back down to? It's I'm not safe. And then as far as in relationship to their family and their loved ones, you know, worrying about their own safety, and then going home and interacting with their family members. If they live with other people, that is a whole other layer of stress as well, of I'm not safe, and is my loved one safe? So you're adding that. And so what people can do for those people in their lives, other than obviously checking on them, is going back to, we discussed those same mirror neurons. So what's great about empathy is that you can co-regulate with another person. You can help them co-regulate their nervous system. And when you are interacting with this person, even if it is in person or face to face, like FaceTiming or Skype, which I would really recommend, is yes, you can check on them and text them. That's great. But that face to face contact, that eye contact, creates vagal tone. And you can radiate, again, that loving kindness and compassion to them, because in their mind body, they're experiencing a lot of, I'm not safe, right? And so before you interact with these people, before they come home, or before you FaceTime or Skype them, grounding yourself and showing up for them in a way that radiates safety and compassion and kindness, and being able to reflect back to them. That's why they're called mirror neurons. Reflect back to them, sort of just a message of like, it's gonna be okay. And I'm not saying that because I have a crystal ball, but what I'm saying is, in that moment, you and your mind can be thinking that, and that can be the energy that you're reflecting back to them, is just giving positive, warm, co-regulation skills. And then on top of that, you can actually breathe with them. So offering to breathe with them, it's really powerful to breathe with others, really, and to just say, hey, do you want to like take a few deep breaths with me? So, and you know what would be great is, I'm thinking now, is we should do it right now.
Yes, please
You
lead
guys
us
want to
through
do
some.
it?
Lead us through.
So,
You did a breathing exercise earlier. Someone actually just talked about, you know, their teenage sons being worried. So I think this is something you can maybe even do with your kids as well. Just kind of sit them down, distract them for a bit, and everyone just breathe.
and breathe together. And so bring the bottoms of the feet to the floor. And you can sit upright. You don't have to be in a perfect meditative posture like a Buddha statue, but just sort of sitting up so you have plenty of space for the belly, and sort of lifting the top of the head up, relaxing the jaw and the muscles of the face. And then you can keep your eyes open or closed. Again, that's totally up to you. So breathing in through the nose. Take the breath down through the lungs into the belly. Let the belly expand like a balloon. Slowly contracting, air begins to exit through lower lungs, upper lungs, out through the throat and nostrils. Smooth transition to inhale. And you can, especially with kids, you can ask people to put their hands on their belly. So teaching sort of that skill of like, am I belly breathing? I don't know. Is it happening? That's another way that you can do it. And for people with kids, I recommend there's a really great Elmo video where he talks about belly breathing. So check that out.
For the younger kids, maybe not the person who asked about their teenage sons, but
Not
like Elmo. Again, you can ask questions to us. We're talking about taking care of your mental health, relieving anxiety during this uncertain time. We're with Jamie Driver. She's a yoga therapist, hence talking about all the breathing and grounding us. And she also does integrative wellness and works with medical professionals and healthcare workers, first responders. And we're just talking about the stress that this pandemic can really have on them and everyone. Talk about what stress during something like this might look like for people. So if a lot of us might have a tough exterior, maybe even a healthcare worker comes home, they look like they're fine, but what are some signs that maybe family members should be looking out for, that they just need a little assistance, need a little help?
Yeah, so there are a couple ways that the nervous system can respond to stress, and it can move towards what we call hyperarousal or hypoarousal. And so blanket terms for that would be anxiety, or even getting a little bit angry, a little tense, or towards depression, towards apathy, of like feeling like you want to give up. Again, all of these experiences are very valid at this time. And what will also happen is that people will try to self-regulate. And what do a lot of us adults self-regulate with is alcohol, right? I mean, I've seen a lot of memes about people drinking, which is totally fine. I'm not judging at all.
Right. That can relieve stress, but maybe, obviously an increased use or an excess is a problem.
Yeah, well, it's just know that the craving for that is actually coming from the place of trying to balance your nervous system, and that there are other tools that you can use. And so if you're looking, ask yourself, am I looking for stimulation, or am I looking to calm myself? And then once you can answer that question, well, what I really could do is go for a run, or what I really need to do is lay on the floor and stretch and do some yin yoga. And, when I teach the people that I work with, there isn't a perfect way to cope. There's not like, this rule works for everyone, because we all have different nervous systems based on even in utero. So like pregnancy, when you're in your mother's belly, developmental programming, and then what's going on in your life and what your values are. And so some people will feel better if they're feeling really hyper aroused, if they can go for a run, because they want to move the energy through somatic processing. They want to dance, again, big fan of dance therapy. And then sometimes if you're feeling a little, what would be better is to lay on the floor and do those deep belly breathing techniques. And so it's different from person to person. And what you have to do is be empowered to take your own mental health into your hands, and to notice and just sort of experiment with what works. Like, okay, I'm feeling this nervous energy. I'm going to try that thing where I do like a dance party in my kitchen for 5 minutes and see if I feel better after. And if afterwards you actually feel worse, maybe that's a sign, okay, maybe a bath instead is going to be better. And then for people that are feeling really hypo-aroused, they're feeling like really depressed and stagnant, heavy energy, I really recommend actually just like relationship for that, of you want to self-isolate, get that, makes sense, and yet having that interaction with people can help you kind of break out of it. And if you see someone struggling with that, and I'll be transparent, I know a lot about all of these topics because I've struggled with some of these things myself. And one of the best things someone ever did for me when I was kind of going through a little depression was she forced me, I was living in Austin, Texas at the time, and she forced me to get out of the house. We went to Barton Springs, and it was like out in the sunshine. I had to jump into cold water, and it was like, whew, okay, I'm back. And, you know, when people say they want to be left alone, that's really particular to like your relationship with that person, and knowing how much you can kind of push them or guide them, like, come on, like, let's just go for a walk. Let's just start by going for a walk around the block and see. And if that feels good, maybe we'll walk a little bit further, or maybe we'll do something else. And so, yeah, I just, you know, and really breathing together and being present. And then finally, being willing to be present with pain. Like if someone is struggling and they're uncomfortable, sometimes you have to resist the urge to fix it and just let them be and express their pain. And by being with them, that is healing.
Yeah, I think that's a lot of what people are trying to cope with too, and what's causing anxiety is this is something that we don't know much about as far as coronavirus, COVID-19. We can't really fix anything right now at this moment. The best thing you can do is, you know, stay in your house and keep your distance from people is really what we're doing right now. But that is part of, I think, what causes anxiety too, is that we can't just like fix it right now.
Yeah, the future is uncertain. We always want to know what's going to happen, and we can't. And that's frustrating. It's frustrating for everyone, I think. And, you know, these practices, these present moment oriented practices, the future is not here yet. And so bringing yourself into the present and that back to, in this moment, I am safe. That is what you have control over. It's called locus of control. So, you know, the serenity prayer, it works for everyone. Not, you know, you don't even have to have a spiritual practice, just being able to understand this is what's in my control and this is what is not. And this is the present moment and I am safe and healthy. And that's what I have control over. So I do have compassion for the anxiety because, you know, and I'm a perfectionist and I would like to know what's going to happen. And yet I'll give you what, you know, my dad, I'm Southern. So my dad says, worrying is like a rocking chair. It gives you something to do, but it doesn't get you anywhere.
Sorry, I had to take a drink of water. Yeah, that makes sense completely. And you've given us some great tips, some ways that we can, you know, we can relieve anxiety, kind of cope with what's going on a little bit. And also for those healthcare workers out there trying to separate, you know, home from work and just decompressing when they are able to get home. 9 Health, I want to mention, has mental health screening tools on our website at 9healthfair.org. You can anonymously take a depression screening and an anxiety screening. You'll be connected with free help if that's something that you need at this moment in time. 9healthfair.org, and click on our e-tools and you'll be directed toward those tools. And all this week we're going to talk about mental health. Tomorrow we are set to talk about, you know, coping with those feelings of helplessness at this time. We'll talk with a doctor about kind of dealing with those feelings, and hopefully Dr. Coley can join us as well. But again, this is Jamie Driver, and she's a yoga therapist. She provides integrative wellness, and she's done a great job giving us some tips today. And she mentioned, you know, instructing yoga. She's an instructor at Kindness Yoga, correct? And you can get 3 free virtual classes. Is that right? So that's something else to do in your living room while you're at home.
Yes.
And to relieve stress.
Is offering a lot of stuff online right now, and I would just like to say, you know, part of the business name and mantra is like trying to offer people kindness. So that's another thing we can do for each other right now, is just try to be kind.
Right. That's a great note to end it on. So be kind to one another. If you have questions and you need answers, put those in the comments and I'll get those answered for you. Even if they're general questions about the coronavirus, I can also get those to Dr. Coley, and she'll get those answered for you as well. And Jamie, thank you so much for joining us, and we are going to sign off for now.